or you get in an accident. It's very stressful. And she's showing you some simple things that you can do. Just pause down, take a deep breath, change your attitude a little bit, and it's just simple things you can do. It's a lot of times we think, oh man, I gotta control stress. I have to you do like an hour-long meditation. I gotta do something that's more involved. It's not. And stress, in order to control stress, is a very simple thing you can do. Very little things you can do to handle stress. You don't have to do things that require quite a bit of your time. Okay, so like I said, I'd be more than happy to give you that clip, from YouTube, and you can watch it one more time to appreciate what she's saying, because she said quite a bit of stuff about how you should handle stress, and you'll see that after my talk today, you'll see why it's so important to control stress. Stress is something that can lead to health problems. It can lead to serious problems that later on will require surgery or a lot of drugs, which I don't think a lot of you guys probably want to consider. Why is stress so bad for you? That's why I think that some of us are here. Is why is stress so bad for us? Well, the first thing is it causes you to be tired all the time. It makes you fatigued. How many of you like feeling tired all the time? Especially towards the end of the day after a long day of work, right? Some of you are retired, so you're very fortunate, but you still have some stress. It's not, it's not like it's not there. Moods change for no reason. You can't concentrate. There's a laundry list of stuff here when you are under a lot of stress. You cry over stupid things. You can't sleep. You get headaches. Stress a lot of times is mental. You have deadlines. You got to worry about being to work on time. You got to take care of a lot of things, which there's certain things, deadlines that you want to accomplish, and unfortunately you feel overwhelmed at that point some time. So anyway, headaches, and you get fearful but don't know what's frightening you. You have nightmares at night a lot. Your palms get sweaty. You're accident prone. I remember this morning I was trying to prepare for this talk, and I was just inadvertently bumping over cups with pens and stuff, and I was like, man, this stuff really is stressful, isn't it? But yeah, it does cause you to be accident prone. And then of course it causes you to be hungry all the time. So you can gain weight from being stressed. So no matter how much you eat, you're always hungry. And then of course there's no motivation to do anything. You just don't want to do anything. And then of course you have loss of enthusiasm. You just don't like your life anymore. You wonder why you're in this relationship. Why are you in this job? Why are you in this car? Why am I not richer, or whatever, right? And there's a lot of things that go through your mind because of what stress can do to you. Now, oops, this is stressful. Why are you not working? Oh, maybe I turned it off. There you go. Okay, we're going to get into how detrimental stress can be, especially to your nervous system. Now, the reason why I bring up the nervous system is because the nervous system actually is the master control in your body. It actually is the computer system in your body. It controls every single thing that goes on in your body. The nervous system comprises of the brain, the spinal cord, and a multitude of nerves that run through the body. So there's a highway of nerve fibers that reach all the cells in your body. There's about 75 trillion cells that comprise of your whole entire body. So quite a bit of cells, and the nervous system actually controls all those cells. The nervous system runs the whole entire body. In this respect, it is responsible for making sure the organs within the body do the right things at the right time. So you can imagine if your heart, your liver, your kidneys were not talking to each other. That's pretty bad. You probably develop some serious health issues. It's also responsible for making the body react to external stimulus. So external stimulus is something that stimulates you from the outside. So imagine you're gardening outside and the sun is bright, like right now it's really sunny. If your body couldn't sense it, if your eyes, your skin couldn't sense the heat that was bearing down on your body, you wouldn't be able to sweat. Your body innately knows to sweat, to cool down your body. Did you know that your body temperature is supposed to be at 98.6 degrees Fahrenheit? What happens when you go up 1.5 degrees? Let's say you go up to 100 degrees. What do you call that person? What do you call that situation? It's a fever, right? It's only 1.5 degrees. So you can see here, the nervous system schedules, monitors, and makes decisions that keep the body functioning and aware. This is commonly termed homeostasis. Homeostasis is a fancy word, but it basically means the body likes a balance. It likes to have a certain balance. Like I said, with 98.6, it wants to stay around there. You know, it doesn't want to go any higher, it doesn't want to go any lower, or else you have health problems. So this is as you can imagine, this is an extremely complex task that we often take for granted. And you know, a lot of things that our body does for us, just like the foods you eat, you know, when you put food in your mouth, you don't think about the enzymes that break down the food. You don't think about how there's peristalsis that causes the food to go down your esophagus and into your stomach, then your stomach secretes acid to digest the food and then churns the food and goes through the whole digestive process. It's automatic. There's an automatic system in your body, and that's your nervous system. And actually it has two parts. The first part is the sympathetic nervous system, which we'll get into shortly, but also the parasympathetic nervous system, which is sort of the anti-sympathetic part of it. Okay, so I'll get into that. So anyway, if the nervous system was to fail or become damaged, a person could lose the ability to walk, talk, feel pain, and a whole host of other things. How many of you know Christopher Reeves? You know Superman? Yeah. When he fell off that horse, what happened? Right? He broke his neck, and in fact, he actually fractured his the top part of the neck, which is the atlas, into 4 parts. And he actually caused a lesion in the brainstem area, and it caused him to be paralyzed from neck down. Mm-hmm. He had to feed through a tube, as you recall. So the nervous system is quite important, and if you have damage to it, it's going to manifest into health issues. So does stress affect the nervous system? And if so, does it cause malfunction? This answer is kind of tricky because, you know, the nervous system, and you can see here, the nervous system is different from most of the other systems within the body. Systems like the cardiovascular, the lymphatic system, you know, all these other systems that your body has, the digestive system within the body, because it effectively monitors stress for the body. So in other words, it looks to see if there's stress on the body, and then it causes a change. You see, senses that the situation is stressful and causes a physiological change to the body to occur. So just like I said, with when outside is really hot, what happens? Your body starts to sweat, right? It tries to cool things down. It causes a physiological change. Now, all this is fine and dandy. We're assuming that the nervous system is functioning 100%. Okay? Certain people, unfortunately, because of accidents, trauma to the head, trauma to the body, or you know, even as early as childbirth, any history of trauma, falls, accidents, or injuries can cause this very top bone to slip out of place, limiting the ability of the brain to communicate with the body. Okay, this area actually regulates how your body deals with stress. So if you have irritation here, guess what? The nervous system is not going to function very well. It's not going to respond to the stressful stimulus, if you will, from the outside. And I'll get into that a little bit. Okay, so some of the physiological changes include increased heart rate. I mean, when you get nervous, I don't know, some of you probably remember when you had a final exam or some test, right? Your heart's racing, or you find that significant other that you're very attracted to, or your heart races. Okay, so you're in a stressful situation, but in a good way, right? And then, of course, you have adrenaline that's released because it gets you pumped up. And also cortisol. Cortisol is a natural hormone in your body that actually helps calm down stress. It actually helps you deal with mental, physical, and emotional stress. And it's actually released by your nervous system. And unfortunately, what happens when you're under a stressful situation all day long, for weeks on end, for months on end, for years on end, that cortisol level actually gets depleted, and unfortunately, a lot of times our body cannot recoup or meet the demands, if you will, of the cortisol that you need. So you act out similar to that one First Step video that, you know, these guys sort of get overwhelmed, and it's due to the fact that you have low levels of cortisol. Now, one thing that's very interesting is that the bloodstream, you see here, drawing blood away from the stomach and extremities of the body and dilating the pupils of the eye. So what I find really interesting is that when